Welcome to SROA Soundboard, a podcast for radiation oncology administrators. Here's your host, Tammy McCausland.
Hello, I'm joined today by Monique Chisem, Photon Chief Radiation Therapist, Radiation Oncology at the Miami Cancer Institute. Monique is here today to talk about her time as a radiation oncology clinical specialist. Welcome, Monique.
Hi, thank you so much for having me.
It's great to have you here. Why did you apply for the radiation oncology clinical specialist role?
I always get that question because it was a new role at my center. I have always been passionate about education, mentorship, and elevating patient care. And the role was a perfect blend of all these things. I remember going to my it was an RTT meeting, the first meeting of the year. And our director at the time, she mentioned that this role was coming up, and I stopped listening to everything else. All I heard was radiation oncology clinical specialist, someone that will educate the therapist, do workflows, policies, procedures, and I was immediately drawn to the opportunity. So I went for it and I applied for the job.
I was advised that you came to your interview with a binder full of ideas. Why was doing that prep work so important?
As the saying goes, preparation is key. And I wanted to make a good, strong first impression when the position became available. It was new. It was new to the center. We had no idea what this person would be doing, with the exception of the job description that we got. And I wanted to show that I was the right person for the job by putting together some things that I thought would be appropriate for that clinical specialist to do. So it not only helped me kind of gain the winning vote for the role, but it also helped me stay organized within my first 30 days because I already had an idea of what I wanted that role to look like.
And what was in the binder?
It's a great question. It was project ideas for the RTTs. So I wanted all the RTTs that we worked with to have professional binders that included resumes if they were interested in promotions in the future. That's one thing that a lot of employees don't have, right? We often don't upkeep our resumes. So I wanted everyone to work on a resume. It also had sample competencies that I would be using for the therapist, project ideas, like making sure that everyone was comped on different machines, and my resume, of course, and other projects that I had worked on within the department.
When you got the role, what were the first weeks and months like?
I was excited, and it was an adjustment, of course. I was really focused on building relationships in a different avenue. Prior to this role, I was a lead therapist for 4 years. So I knew my team well. I knew the therapists, I knew the physicists, I knew the doctors. But this was coming at the team at a different angle. I'm not here to do the day-to-day operations. I'm now looking for deficiencies and gaps within the clinic that I can fix. So it was really reintroducing myself to not only the therapists, but the leaders, physicists, and doctors, and sort of sitting with each of them and addressing gaps that they see within the clinic. So that was my first few weeks.
And you built an orientation and training program. Could you talk a little bit about that?
Yes, I sure can. What I did was I created the onboarding for radiation therapists. So when I first started at Baptist almost 8 years ago, so long, you were kind of just assigned to a therapist and the floor, and you learned as you grew. You just kind of knew that this is the next step and this is what you're doing, but there wasn't anything formal in writing as to benchmarks that you should meet. And I always kind of thought, well, that can be challenging for someone who may be a brand new therapist. You're sort of just learning on the fly. And I wanted us to have benchmarks. So I created checkpoints. So the first 30 days, this is what that would look like. The first 60 days, this is what a therapist should know. And it is a built-in comprehensive onboarding for all therapists within our department.
How did you shape the role?
I leaned into my strengths. So I love to educate, I love to teach, and I love process improvement. So I introduced the structured onboarding, like I said, for new therapists. I enhanced any policies and procedures that we had and protocols. And again, I worked closely with our physicists and our physicians and our leadership team to streamline workflows. So if there were any deficiencies, I worked to bridge those gaps.
You were also instrumental in engaging the radiation therapy students. Could you focus on that a little bit?
Yes, absolutely. That's the other part. I know that students typically come into healthcare and it can be challenging for them. Again, it's also sort of learning on the fly. They have documentation from the school, but there was also sort of a conduct that I wanted our therapists to have with the students. So I was the point contact person, I was also the clinical coordinator for all of the students. And what we did over time was we paired them with therapists that really liked to teach. I think that's something that we sort of miss in healthcare. A lot of times you really have to find out who enjoys teaching and you should pair your students with them. I know that every center can't always do that, but when you can, you should, because you see how well the students do over time. From this role, we also learned about a scholarship program for students. I took lead on that project, making sure that radiation therapists were a part of it. Historically, we weren't. It was just for nursing students only, but we spoke to leadership, and they really helped us get that opportunity for some of our radiation therapy students. So we now have a scholarship program for radiation therapy students where they are hired as sort of like radiation therapy assistants, and they are paid for that very minimal pay, but it's a great opportunity for them. And we are promised to hire them once they graduate from school.
That's awesome.
Yes.
What was the feedback from the radiation therapy students?
They love it here. All of our students, everyone, and we wish we can hire all, but we can't. They really, truly love working with us. I also met a lot of them through teaching. So I also teach at one of the radiation therapy schools. So kind of seeing me in the light of teaching and also seeing me in the role of therapist in a clinic, I think they also kind of see themselves like, oh, I can do that too. So they really enjoy working with us. And I do a lot of kind of pulling them apart if they're in clinic, setting them aside if they have questions. I do take my time to answer those questions. And my goal is to make them feel welcome, right? I love radiation oncology, I love radiation therapy, and I really want everyone to love it too. So
that's awesome. What were the most rewarding aspects of the clinical specialist role and the most challenging?
I think the most rewarding is seeing the therapists gain confidence in new technologies. And not only that, falling in love with education as well. I send them a lot of CE credit opportunities. I encourage them to also participate in a lot of radiation therapy activities like teaching, writing for ASRT, like submitting an abstract if they can. So because of that role, we've gained a lot more therapist involvement in special activities, which we didn't before. And not only that, the improved patient care. I think that confident therapists perform better on the floor overall. Prior to, I think people had a harder time asking questions. Now they know they can seek me out. They also bring me a lot of concerns, which is, you wouldn't think it's beneficial, but it is. They'll say, hey, Mo, for example, we should get a competency on inserting an internal eye shield. That's not something we ever did in the past. You saw one, you did it, and now you're doing it. And a lot of times people weren't confident, but they would do it anyway. So now we have competencies for so many things that we didn't before.
That's awesome. And the challenging part?
Balancing responsibilities with the clinical demand. We are a very big center, very big. So we have proton units, we have photon units, we have, on our photon side only, we have cyber, gamma, zap, tomo, true beam, we have simulation. So the most challenging part was making myself available for all these things. I created comps for a lot of areas that we didn't have competencies for. I try to make myself present at the time for special procedures. So I think that was the most difficult part, was the clinical demand. It would also be valuable for bigger centers to probably have more than one clinical specialist. But it was a new role, so we didn't realize that that it would be so useful at the time, but yes.
And you decided to leave the role to become a chief therapist. Can you talk about why?
That's also a really good question. I loved being a clinical specialist, and it built me. It gave me additional skills that I didn't already have. But I thought for my professional growth, it's great to have leadership experience. So although there are some aspects of leadership as a clinical specialist, I thought it would be most appropriate to move into a supervisory role that I can have documented leadership experience. So I love education, but I also love leadership. So this was my opportunity to sort of build on that. And if there's ever a clinical specialist, supervisor, or manager, or something like that in the future, I would be happy to go back in. So, but we do have a new clinical specialist now, and I'm currently onboarding her. So I'm still very much a part of that clinical specialist role.
What did you learn from the clinical specialist role that you have been applying or think that you will apply in your role as a chief therapist?
Giving people the opportunity to learn. As I stated before, coming in as a therapist to the center, it was very big. There were a lot of therapists, and you were expected to sort of learn on the fly, be competent in 6 weeks, and ready to go. And I realized, kind of as someone on the outside looking in, no longer being actively in the clinic as a treating therapist or a treating lead, that not everyone is as confident and works as quickly. So it's really taking a step back and giving everyone the opportunity to not just learn at their own pace, but have those check-ins. So I also created a collaborative support meeting with new hires, asking them, independent of the clinic, how are things going? And as simple as it sounds, asking them, are you comfortable driving independent? Are you comfortable using the console? Are you comfortable with ARIA? Are you comfortable with setting up the patients? And you'd be surprised how many people said, I think I need more time with this, that, or the third. So I think that's one thing that I've learned, and being a chief coming into this role as I'm hiring new therapists, whether they have experience or not, it's really giving them the opportunity to have the time they need to really catch on. We're a busy center, and yes, we're therapists and we can all do, the same things, but some of us need a little bit more time than others.
It's good that you have been able to recognize that, and it's probably very helpful for the people that you're onboarding.
Yes.
Thinking about radiation therapists who might be interested in a role like the clinical specialist at their cancer center, what advice would you give them?
So, most importantly, continue to learn. And if this role is not available at your center, and it's probably not at a lot of centers, advocate for it. Show your center why having a clinical specialist is important, bring the deficiencies, and not in a negative way. Say, hey, I really think we benefit from learning. I really think we benefit from having a dedicated person to help teach. So most importantly, be proactive and stay curious about learning about radiation therapy. That's something that I did even before I became a clinical specialist. I was always interested in learning about new things. If there was a new class, or I was always interested about what the nurses were learning as it applied to radiation therapy. And I would wonder, is this something that radiation therapists can benefit from? And I'll give you an example: anesthesia. We do it, but what do we know a lot about it? We just know the patients are being put to sleep. What are the signs? What do we look out for when the patients are asleep? Safety concerns. So just be proactive and interested in learning.
And thinking of administrators looking to create this role, what key lessons learned would you share with them?
To clearly define the role, scope of practice, and the expectations for that person. My clinic did a great job of outlining what they wanted it to look like. We didn't know that it would grow so quickly as we were adding new machines, but really have clear and defined expectations for the individual. And support from leadership was needed. There were a lot of times where I had to check in with the chief therapist and say, hey, the therapists aren't comfortable doing this. Can we take some time to train? Can we take some time to educate? And I would need the chief's support to say, yes, I can give you 30 minutes on a Wednesday, for example, to review these policies, procedures, or workflows with the therapist. So leadership has to be supportive of this role, and gives your lead therapist the clarity to just focus on your daily operations. So I don't think that it would be hard to implement in clinics. I would actually think if you have more than 10 therapists, this would be a role that should be called for.
Do you have any final thoughts?
This job was an incredible opportunity for me, and it is now for our new clinical specialist. And it really does bridge the gap between clinical expertise with leadership and education. I also learned a lot of my leadership skills from being a clinical specialist, because it's very independent. No one's telling you what you have to do. You're sort of like, okay, this is new. This is what's next. This is what we need a workflow for. I'm grateful for the experience, and I hope to see more centers with clinical specialists in the future.
That's awesome. Thank you very much for your time today, Monique.
Thank you so much, Tammy. It was great to meet you.
You too.
Thanks for listening to today's podcast. To learn more about SROA, visit www.sroa.org.